The spotlight on early childhood development has never been brighter, and for good reason. Research shows that children's early experiences, especially those in their homes and communities, lay the foundation for lifelong learning, development, and overall well-being. Today, as many as 200 million children under the age of 5 are not developing to their full potential. Encouraging warm and supportive relationships with caregivers at home and in early childhood settings can help reduce that number. We know a lot about what can support children's optimal development, and it starts with a child's early caregivers. Responding in a nurturing way to the signals that infants and children give, babbling, cries, and movements, supports children's development. Children feel more secure when they know a caregiver will respond to their needs in positive and predictable ways. Talking about and encouraging children to participate in daily activities can help build supportive relationships. Similarly, engaging in problem-solving or creative activities, such as reading and talking, drawing, playing with numbers and building materials, also supports children's development. Early childhood programs and other initiatives can help caregivers interact positively with their children to foster healthy development. These programs might include home visits or group sessions in which trained facilitators model interactions and coach parents in a hands-on way. In peer-to-peer models, mothers who have been trained in positive parenting practices help teach new mothers in their community and conduct trainings during home visits or through routine community activities. Media campaigns can use radio, television, and billboards to communicate simple, targeted messages about practices that promote young children's optimal development. In some communities, newer technology platforms, such as cell phones, are also being used to share this important information. Successful programs, including parenting support programs, must be culturally relevant and reflect a deep understanding of parenting, child rearing, and community practice. The most effective programs are often developed in partnership with local leadership and build on successful parenting practices that are already in place. Caregiver support programs should provide simple, concrete messages, activities, and materials that parents can easily do with their children at home. Caregivers should be given hands-on opportunities to practice new activities with their children and receive feedback. It is important that programs emphasize to caregivers that they can support their child's learning, including early literacy, even if they're not literate themselves. Trainers and facilitators who have direct contact with young children's parents and caregivers should be trained in what's important for a child's development, as well as how to interact with caregivers. During the course of a program, it is important to follow up with caregivers and children to ensure that new knowledge and skills are being used and positively affecting children's development. Interventions that support parents and family members positively impact caregivers' knowledge and interactions with their young children. And by increasing their fathers' or other male caregivers' involvement, these programs can promote overall family well-being and improve parents and caregivers' mental health. There is no relationship more important to a child's life than the one that the child has with his or her caretakers in their earliest years. Promoting responsive and stimulating relationships between caregivers and children has positive impacts that last a lifetime.